My name is Hoyne. I'm a consultant psychiatrist, and I would like to report on a paper by Al-Basri. Mediterranean diet is not related to depression, anxiety, and stress among young university students in the UK. It's a cross-sectional study, which some quite unusual outcome. I come to that later because it's part of the exploratory data analysis. This study was conducted at the University of Chester, and there were quite a few. Just go to the table. Students from different areas. In total, there were 125 students, more female than males in this study, more undergraduates than postgraduates, and more British EU students and international students. So what they assessed was the socio-demographic variables I talked about, the Mediterranean diet score tool, and they used the depression and anxiety and stress scale, 21 items. So what they looked at was the correlation between the symptoms of depression. Here, this is a scale about the severity. Lots of people had, so this is the way it's diagnosed. So there are different scorings, and if you score higher, let's say above 21 in depression, anxiety 15, and 26 in stress, that would be related to severe problems. So the results, this is the depression scale, and there are quite a few people who are normal, most of them, but there are also people with mild, moderate, and severe depression and anxiety and stress. So the Mediterranean diet scale has 14 items, which is use of olive oil, vegetables, fruit, some meat, not too much, butter, and other milk products. And so there were beverages, and interestingly, and I come back to that, they said 3 glasses of wine each week, red wine in this case, and other vegetables, less sausage, and fish and pasta. Right, so the question is, so the adherence, so first thing was the adherence to the Mediterranean diet among participants, and what's prevalent is that many people don't really bother too much about the diet. However, some people had high scores on the diet scale. Females were more considerate with their food, and the younger people were more considerate as well. So that's a score of 9 or higher. Right, okay, so the adherence was not greatest. And I can show you the relationship with the, which is a main study, a relationship between the Mediterranean diet and stress. Not much, not really significant. Same for anxiety, no major significant correlation, and the depression and Mediterranean diet. When you looked at individual items, it's the fact that people, as I said before, who were younger, was more adherence to the diet, and there was some relationship with depression and demographic characteristics. So people who were from abroad and were older had more mental health problems, if you can say that, from a scale which is usually not meant to do the to look at individual items. However, when you looked at one item, and it was consistently standing out, was drinking Mediterranean wine, or drinking wine more than 3 glasses a week, it was prospective against some stress symptoms, such as hard to wind down, nervous energy, and feeling touchy. Same in the depression parts, and also in some anxiety items. So the unexpected finding here in this study is that moderate wine consumption seems to protect against mental health problems. The rest of the items do not have any correlation with mental health problems. So this is good news for people who have the odd glass of wine. Certainly, it's not meant to drink a lot. I'm grateful for your interest. If you want to read more, please check the paper at www.globalpsychiatry.co.uk, or you can go and check our website, where we will also announcing a conference soon. Thanks for your interest, and if you need any more information, please don't mind to contact us.